diving into today. So in terms of what the People's Health Watch actually is, I wanted to first set the kind of context to explain why we felt the watch was necessary. So we believe at PHM UK that the current neoliberal economic system founded on colonialism, racism and patriarchy is violent to those most marginalized, reproducing conditions of socioeconomic inequality. It puts profit over the health of people and the planet and has created the multiple intersecting crises, that's COVID-19, structural racism, climate breakdown, to name a handful, that we face today. Nearly a year and a half on now, the pandemic has only made explicit the injustices we already knew existed. Yet people and communities have been resisting and imagining from well before COVID. That is a core part of what really inspired us to create this space. And in particular, we feel the health community needs to team up with people fighting on issues such as food justice, workers' rights, migrant solidarity, gender equity, and lots of other things if we're really to achieve health for all. I wanted to set out the intentions of the watch, which really lies at the core of it and is the focus of the watch upon which everything else is built. We had 6 core intentions. So we wanted to create an emergent, that is a dynamic, ever developing, change embracing space that centered health justice. In terms of the 6 kind of intentions, the first one was around knowledge, to deepen our shared understanding and intersectional analysis of the current state of injustice through highlighting key social, political, economic, environmental, and commercial determinants, which have the greatest impact on health, care, and well-being in the UK. The second was personal experience. So we really wanted to center the participation of people and communities with lived experience oppressed by the current systems, who, as one of our panelists, kind of Guppi, wrote brilliantly in Reimagining Public Health, which you should all definitely read. She wrote, these people are already changing the rules of the economy through their own creativity, commitment, and need to survive. And Fazana Khan, who is from one of our friend or kind of ally organizations, Healing Justice London, she speaks about those at the margins being the most innovative and imaginative because they have no choice but to be. So we really want to honor and uplift and learn from these voices. The third thing is to educate, to share and learn from the ways in which people are resisting the current systems that shape inequity and supporting their communities to challenge injustice. The fourth is vision, to be a space to dream, collectively imagine visions of health justice for the future. Fifth is roots, and this is really about highlighting local stories, but also any divergence as a consequence of devolved national or regional or local governments, as well as how we might respond to this. And the final one, which really underpins everything, is collaboration. So how can we build meaningful relationships between people and across struggles in solidarity to build power for the health justice movement? I wanted to take just a minute or two to explain kind of the 4 themes of the watch. So in conceptualizing the space, we framed 4 areas or lenses through which it was helpful to understand health justice work. And by doing so, we're able to better understand the lay of the land or movement ecology, as Neon would call it, to see who's doing what work, and also helps us understand the different areas in which the watch could operate and will operate. The first is context. This is really about understanding the background and taking into account different aspects of society that affect our health. The next is resistance. So this is how is resistance happening, who's resisting and how, basically. The third is imagine. So we demand that we break free from the structures that limit our thinking. We really want to dream, think big, and speak aloud the visions of a more just world, know what could be possible. And the last one is connect, and as the kind of the famous, oft quoted Audre Lorde says, there's no thing as a single issue struggle because we do not live single issue lives. So we really seek to explore how we can connect various areas of work and how they intersect and weave together, and how we can make these connections more meaningful and intentional. And obviously, these all 4 areas overlap enormously, and different people are working across and straddling across these different themes, but it's just a framework for us to be able to understand what we want the watch to be, basically. And And the final thing I want to say is, this is where you guys come in, and all the groups that we wanted to connect with come in. Rhiannon will speak a bit more concretely about how you can get involved towards the end, but essentially the watch, the People's Health Watch, seeks any one individual or organisation that feels they want to collaborate in working towards fulfilling the intentions we've set out. So I want to stress really, and this is a hard thing to get our heads around, and it's been for us as well, but this isn't a linear process. And that's the most exciting bit, So for the time being, we have, these activities take two primary forms. We have the website, which is live, where contributions can be hosted. And these can be kind of testimonies from people, for example, with lived experience facing health injustice. It can be critical analysis. It can be expressions of resistance, maybe in the form of poems, music, videos, anything really. And then there's these virtual gatherings, of which the first is this one, but they can take a range of forms. They might be public hearings with those with lived experience presenting their testimonies, and advocates and researchers providing evidence. And alternatively, there might be more creative spaces and participatory workshops for radically imagining together, what the future could look like. We would like to memorialize these kind of connections and reflections and imaginings into some form of manifesto towards, perhaps in a year's time or something, but that's not very concretely conceptualized. And I want to stress, like I said, it's not about the output. We want this to be a space for connection, for flourishing together. So yeah, take home is essentially anything you feel fits into the watch and you'd like to discuss, please just approach us, and I'm sure we can find a way to collaborate. So that's kind of PHM UK and the watch. I wanted to hand over to Anuj. It's a real pleasure to hand over to Professor Anuj Kapilodeswamy, who will be moderating the discussion today. So Anuj is an interdisciplinary social scientist, trained in sociology and public health. He's a professor in global health policy and equity, and the director of global health and global engagement and partnerships in the School of Health and Social Care at the University of Essex. But more importantly, she's a long-time PHMer, based both initially with PHM in India and then in Scotland as kind of the lead convener. So it's a real pleasure for us to invite Anuj to moderate this session. So I'm going to hand over to her.
Thank you, Kavyan. It's really exciting to be here today and to hear and see the People's Health Watch take shape. There's been a lot of discussion and background conceptualization and thinking, and I'm really excited that it's finally taking shape and we are able to launch this. And I'm deeply honored to also be at this webinar, be sharing the panel with friends who have inspired me in my own journey and around health justice and my own thinking. As an academic activist who's really interested in the intersections of equity and rights and social justice, and how these determine and produce states of health and well-being, last year and a half has been a minefield, and to say the least, very, very overwhelming. So I wanted to just take a few minutes to just contextualize why we are talking about People's Health Watch now, and why also thinking about the urgency of it. What have we learned so far? I mean, clearly the current pandemic crisis has brought discussions on inequality center stage, from the differential socioeconomic burden and impact of the lockdown measures, the policy responses to COVID, to the differential access to hospital beds, meds, and also most critically, the vaccine inequity that has been under much scrutiny in the recent World Health Assembly, which Tedros also recognized as the world's, as a catastrophic moral failure. But what is interesting is what the pandemic also reminds us is that by simply focusing on inequalities without an analysis of, or simply focusing on differences and inequalities without an analysis of injustices and oppressions, without applying an intersectional thinking to look at the syndemic crisis of economy, of public health, of climate, and of the broader governance crisis, can only reinforce the differences, make societies more divisive, marginalize the communities that have already been facing this expression, and really lead us to the path and the politics that we are keen to subvert. So in that context, I really welcome this initiative. It is the People's Health Watch in centering these discussions on health justice and not simply on health differences or the differential distribution of risks, etc. And by adopting that intersectional thinking, it is really critical at this juncture when we are talking about building back better, building back fairer. So without spending much time and getting into this discussion of what health justice means to each one of us, and also what kind of politics should underlie this People's Health Watch initiative, I want to go straight to introducing the speakers for today's session. We have Guppi Bola, who's a racial justice busy bee committed to building an economic democracy that supports multiracial working class communities to access wealth and resources needed to facilitate collective healing. Guppi has an academic background in public health, which she focuses the strategic thinking on root causes of social inequalities and ill health. And following her stint as interim director of MedAct, she's currently chair of the Joint Council for the Welfare of Immigrants. Sridhar Venkatapuram, our second speaker, is an academic practitioner in global and public health ethics, an associate professor in global health and philosophy at King's College, and also deputy director of King's Global Health Institute. Sridhar has really been at the forefront of global health ethics for over 25 years, since early 90s, and is known for helping establish the area of health justice philosophy, for engaging with and advising global health practitioners, and for amplifying ethics in public global health education, research, and practice. Third and final speaker is Dave McCoy, professor of Global Public Health at the Center for Primary Care and Public Health at Queen Mary University of London. David has also been a member of the Steering Council of the People's Health Movement, was the founding managing editor of Global Health Watch, which is the alternative World Health Report that PHM and its allies produces. He was also a trustee of the New Economics Foundation for 3 years and is currently trustee of the Center for Health in the Public Interest. So as you can see, we have a very exciting lineup of speakers. And I want to move straight on to asking the first question and getting them to share their own personal journeys to health justice and what health justice means to them. So invite Guppi to give her introductory remarks.
Great, thank you. Hi everyone. I'm actually a little bit overwhelmed because there's some guests from Bangladesh who are joining, and I just feel like it's incredibly late. So I do feeling the pressure a little bit, and I hope this is worth it. So yes, as Anuj has mentioned, I've been working on the kind of intersecting fields of climate health and economics for about 15 years now. So I'm going to try to speak to that in the context of health justice. And I'm going to skip a whole bunch of stuff just now about what I do in my day-to-day. But maybe I'll just transport myself back to the early 2000s. I currently feel a bit like a 21-year-old because I'm firstly in my parents' house for the weekend because they've gone away, and I feel like a giddy child who's got access to my mum's gin and tonic stash, but also because this like group of people on this panel were the kind of initiating group, so Sridhar and Dave and Anuj, who facilitated my my learning and practice around health justice. So I feel really honoured to be among them, and actually really wish that we were together. So back in the early 2000s, which feels like a frighteningly long time ago, yeah, it felt like the intersection between climate health and the economy was only being explored by one network of health organisers in the UK, and that was the People's Health Movement. And so going back to 2005, when I failed my first year of medical school, that actually turned out to be a real blessing for me because it encouraged me to transition towards public health and to transition towards public health as an activist and an academic, by having a deep focus on economics, and a choice that felt maybe quite difficult to understand to my Indian immigrant parents. But in the first year, I couldn't escape this idea that wanting to make people healthy was only really possible if we considered healing beyond the individual, and that this focus was a reflection of the way we understand the economy, a critique of individualized nature of healthcare, and how we've been led to believe that we as individuals are solely responsible for any illness we experience, was something that I really wanted to deeply challenge. So it was quite profound to move out of the medical profession as a result of that. And I began noticing that patterns of inequality showed up in communities that I grew up with, so working class families and families of South Asian, African, and Latin American descent, which made me curious about what was making people sick. And the popular definition, I guess, of health inequalities is, of course, that they are unfair and avoidable. And it wasn't long until I understood that these experiences were unfair and avoidable because they were the result of political choices that have been created, that have created the perfect conditions for ill health. So it became my mission to commit to uncovering what was making us sick and also advocate for structural change. And it was the Global Health Watch report that guided me in thinking specifically about how neoliberal economic ideologies and the practice had infiltrated every institution that governs us and how we manage our health outcomes. And it introduced me to the concepts of systems and system change. And it was PHM events and its community and the campaigns that invited me to be guided by the leadership of, I guess, what I refer to MAPA, which is those who are the most affected people from the most impacted areas, specifically that of Indigenous knowledge and the knowledge of Global South, that has always spoken towards working for a world in which health justice exists. And PHM inevitably led me to MedAct, where in 2014 I joined Dave and Sridhar on a journey that went from being a staff member to a trustee. And in this time, again, I found that MedAct was the only place where I truly felt we were interrogating the root causes of a system that was driving the combined crises that we were facing, which was climate breakdown, militarism, structural inequality, and barriers to healthcare. And which the analysis, unsurprisingly, continued to make up the way that MedAct runs its programs and campaigns. And I'm sure many of you know the organization. During this period, I read a report called called From Banks to Tanks to Cooperation Caring, which was written by an organization called Movement Generation. And I've mentioned this many times in almost every talk I do. And it empowered me to understand what the economic system even was through breaking down the etymology of the word economy. So if eco is the Greek word for home and nomi is the term for management, then the economy is simply the way to describe a home plus management, or more importantly, how we manage our relationships and the resources within our home in a particular place. And this told me that technically speaking, the economy can be anything we wish it to be, and its function and purpose can be redesigned towards a goal that supports health justice. And then therefore that became my mission. It reminded me that the economy is not an objective system and it doesn't function on physics or logic like we were told it is. The economy is a system that reflects power in society, and it is the economy that is leading us towards ill health. And so the focus of this system is to tackle ill health, became my obsession to divest from the extractive economy. So I'm just going to make sure I've got enough time. Yeah, I'm just going to refer to the Health for a Green New Deal report that was launched by MedAct, frames the economy as the economy is making us sick. And it's this framing that describes why, for me, strategy towards health justice is an absolute foundation to an equitable society, because the health of our global population is really the only indicator we have to understand how the economy is operating. So the economy is making us sick because it has been designed by a very particular group of people over 400 years to focus on one simple goal, and that is profit. And to keep function towards that goal, and to keep a function towards that goal, it must extract our natural resources, and it must extract work from our bodies. And through this analysis, rather than the economy being something out there that is intangible and a force that determines so much of my life, I now understand it to be something that has made imprints onto my body. I understand how the economy shows its effects through illness and disease, through trauma and through death. Friends at Healing Justice London, who we referred to earlier, refer to the body as a site of knowledge, a reflection of how the economy is so real for communities who have been subject to the everyday brutality and violence of structural oppression. So when I say health justice, I'm speaking about the work we need to be investing in to support a world in which both the transition out of and collective healing from trauma of the extractive economy. For me, health justice is a practice of reparations that invites us to understand that we won't be living full and healthy lives with a singular focused campaign. And health justice asks us to see where the injustice has taken place, who is responsible for investing in that healing work, and making that work central to both the way we organize as well as the way we dream about what is possible for a different economy.
Thanks a lot, Guppi. That's really interesting. And I'll come back to the idea of economy and whether that speaks to the ideas of redistribution more than other aspects of social justice. But over to Sridhar for his introductory remarks.
Thank you very much. That was amazing, Guppi. So I want to say again that from my part, I'm really thrilled to join all of you. I think that collective action is probably fundamental to everything that we can hope for and achieve. And I was really excited about this webinar because I get to hang out with some of my favorite people, but I wish it was in person because I think this conversation could be sort of hours long and we could actually learn a lot from each other at this point in time, both in our lives, but also point in where we are in the world at the moment. So I'm just going to quickly take up 6 minutes to sort of both tell you a personal journey, but also what health justice means to me. So I guess the quick and dirty story of it is that basically, like every other Indian immigrant in America, I was set to become a doctor, and I was going to medical school, and I realized that I actually that's not where I wanted to be. I was much more interested in the health of people in poor countries, particularly India. And if I continued with medical school, it was very unlikely that I would actually be doing anything about healthcare or health of people in India for the stuff. But what I was also really very interested and affected by was that when I was in university, there was an incredible industrial accident in India called in the city of Bhopal, where there was a Union Carbide sort of toxic incident that had massive health implications and showed very clearly the international commercial determinants, as we call them, of health and how there's a lack of accountability for any of these international corporations and how the government was completely incapable of dealing with it. But also it took decades for that case to be even sort of heard. And I think everybody got like pennies on the dollar for their lives or something like that. It was one of the most grotesque things that I had ever sort of seen, but also it taught me a lot about where my sort of interest and where I wanted to do. And unfortunately, during my 20s, it was also the time of the spread of the AIDS epidemic. And I guess now we would call it a pandemic. And in the 1990s, when I was going through university in my 20s, overwhelmingly, the story was that the AIDS epidemic was a gay men's issue, which I think is a significantly right, which is that the community as a whole was significantly affected. But what it didn't recognize for at least 2 decades was that it was also an issue of developing countries, if not more in developing countries. And some of my work began in New York City, essentially trying to address the neglect of public institutions to the health risks of South Asian communities to HIV/AIDS. So the issue then was that of all the things that gay men had done in order to help themselves and mobilize against HIV/AIDS and the phenomenal work that they had done, what had happened was that essentially minorities, particularly South Asian cab drivers in New York City, were getting infected with HIV, but both the government institutions as well as these NGOs were not capable of dealing with South Asian heterosexual men who were infected with HIV and didn't know how to sort of deal with it. So we created a group that essentially tried to bridge both these communities that were affected with the organizations, but also spread awareness service in South Asian communities in New York City, but also at the same time provide assistance to organizations in India who were trying to address HIV among what was then sort of affecting very marginal social groups. So these were sex workers, both male and female sex workers. These were injection drug users. And these were also people who were essentially so poor that they were selling their blood as a source of income. And so they were getting infected from really poor quality sort of medical equipment. So while we were doing that, one of the things that I did is that I started working at Human Rights Watch because they were interested in documenting HIV-related abuses at different countries. And while I was doing that, and I was doing that for a couple of years, one of the most significant, I guess, conversations in my life happened where the executive director of Human Rights Watch and I were in an elevator one day, and he says, "So what do you do?" And I said, "Well, I work on HIV and human rights." And he said, "Oh, that's really interesting." And I said, "Okay." So then he said, "Well, you know, we actually don't think that there is such a thing as a human right to health." And I said, "Well, this is a problem. If I'm working on it, then how does this work?" So basically he said that, well, you know, so then he sent me an essay by a philosopher named Isaiah Berlin saying that this very famous essay called Two Concepts of Liberty that talked about how liberty can be seen as negative or positive, and essentially democracies and governments should actually just focus on protecting negative liberty rather than positive. And that essentially is what Human Rights Watch does. And so this fundamental problem where one of the leading organizations of human rights actually said that, you know, they actually don't believe that there is a human right to health, I think was essentially the fundamental motivation for what I've been doing for the next 2 decades, which is one, try to provide an answer to Isaiah Berlin, basically say, how do we actually make an argument for a human right to health? And that led me to lots of things, not least, which is more degrees and more sort of philosophy, et cetera, which then turned into a PhD dissertation. And then since then, what I've been trying to do is essentially try to get philosophy, and particularly people who work on social justice theories, to put health at the center of their theories, so that it's not just a minor aspect of something that they're concerned about. Like the economy tends to play a lot of attention in justice theories, but not so much health. And I think, you know, from now on, people will start thinking about health as being more fundamental. And this is also where my interest in this idea that health is not just about healthcare, but actually health justice means not just a right to healthcare, but to the conditions that enable good health over a long period of time, especially over a lifetime. So beyond that, I'm also interested in global health justice. So far, I think we've been focused very much on health as being a national issue. And the idea is that, you know, people who work in global health recognize the global dimensions of health much more than other people who thought it was very local. And now we don't have to make that argument anymore. But the argument that we do now have to make is about what does global justice look like, and what is it, and what should it be, and how does that work. As far as I can see, we don't even have global health ethics. So to think about global health justice, I think, is a much more fundamental question. So I look forward to learning from you about all of these questions, but that's been my personal journey. It's been partly an intellectual journey about answering various kinds of arguments and trying to build positive, constructive arguments for claims to health and the conditions for health, but also trying to put that into action so that when organizations try to do the work that they do, is that they make sure that the concepts that they're working with are coherent and justifiable and will have long reach. Thank you.
Thanks, Sridhar. And that also speaks to how our understandings have moved away from those traditional understandings of justice, which were about sovereign states. So the who of social justice and health justice are very much defined within the confines of those territorial modern nation states. And I think that whole international solidarity again brings, the pandemic especially brings light to that notion. I want to now go to Dave, a third speaker, for his introductory remarks.
Thanks, thanks, Anuj, and thanks to the organizers of this event. And thank you to Sridhar and Guppi as well for kind of providing some really excellent introductory remarks and comments. And I'm going to try and be really quick because I've noticed that there are a whole bunch of people in the audience who've got lots to contribute from their own personal perspectives. So Anuj, you asked me to kind of reflect a little bit on the personal journey. And I'll do a little bit of that, and then I'll just finish off with some thoughts about what we need to kind of think about and focus on in terms of actually moving towards greater health justice. And I guess for me, I would think the beginnings of my experience with People's Health Movement and MEDAC goes back to when I was a medical student. And in my third year, I did my elective as a student in Papua New Guinea. So I went off to Papua New Guinea as a student, and in preparation for that trip, I started to read lots of books about indigenous peoples and indigenous cultures. And of course, Papua New Guinea is really full of all kinds of different tribes and different ways of living. And there was a book written by a chap called Robin Hanbury Tennyson, who was the founder of an NGO called Survival International. Survival International was an NGO set up to campaign for the rights of indigenous tribal peoples. Big focus on groups in South America, Papua New Guinea, Pacific Islands. And this book for me was really transformative because it really provided for me the first window into an understanding of current day structural violence, particularly as it was meted against indigenous peoples across the world. So, you know, we've heard about the history of the Aboriginals in Australia and the Native Americans in North America, but you know, what was eye-opening for me was that kind of history was still happening in the present day world. And it was really an understanding of issues related to land rights, the impacts of deforestation, and the continued colonization of people's lands that was happening in the here and today. That probably is what kind of, I suppose, lit the fuse for my work in political activism and academic activism, if you like. And for about the next 3 years as a medical student, I was an active member of Survival International, and I was on their steering council here in the UK. And it also kind of opened me up to reading lots of stuff that was, you know, far away from the curriculum of being a medical student. So I started to read people like John Pilger, Noam Chomsky, and yeah, I think that notion of reading widely and kind of building on, you know, this huge amount of knowledge and insight and analysis and wisdom that exists is a really important aspect of my own personal journey. Kind of, I suppose, kind of standing on the shoulders of giants. And this actually led me to become very frustrated with being a medical student, and frustrated and kind of unhappy at the prospect of becoming a doctor for the rest of my life, because I really saw working in a hospital sector or working in the health system as being a bit like a mechanic, where you're fixing, instead of fixing broken cars, you're fixing broken bodies. And I actually left medicine and I went back to university to study development studies at Sussex University. I spent 2 terms back in university studying politics and economics and development studies. Eventually I got tired of being a poor student and I went back to being a junior doctor. And then I applied for a job to work in a rural hospital in South Africa. And it was in South Africa that I could see the value and benefit of being a doctor, but continuing to work on issues related to social justice. You know, there were all kinds of opportunities in South Africa to be both a clinician or a public health practitioner. but address those kind of wider social determinants of health. And it was in South Africa that I met David Sanders, who was, I guess, a mentor to me, but also an inspiration. He too was a clinician who managed to kind of straddle the divide between clinical work and social and political work. And similarly, I was able to be inspired by lots of other people, including Steve Biko, who of course wasn't alive, but who was also someone who started off in medicine, but again, worked his way into the field of politics, and was a key thinker in the kind of Black consciousness movement. And I guess ever since then, I've had the real privilege of being able to work both in the field of medicine and health, but also work in the arena of social policy, thinking about economics, thinking about the issues that Guppi talked about, the connection between the planet and the environment with both individual but also social health. And that's been the wonderful thing about this discipline called public health. It provides anyone working in this field to operate across a really vast canvas. So it's always been interesting and intellectually challenging. And that's been one of the nicest things about working in the field of health justice and public health. Anuji asked me to think about how I conceive health justice and perhaps what drives me to work in this field. And it's interesting. I think for me, I've always been drawn less by the suffering of people on the one hand, but more by the anger I feel towards people who abuse their power. And it's an interesting tension, how you kind of manage those two ends of the spectrum. And I think for people working in health justice, one of the things that we need to do a little bit more, I think, is to try and shift the spotlight away from the poor and the suffering towards the other end of the spectrum, to the overprivileged, the overwealthy, to the people with power who abuse their power. And I'm not saying that we should be unconcerned about those who are suffering and those who are victims of injustice. But I guess what I'm trying to speak to is the importance of not falling into the trap of always framing things in terms of charity when we work in the field of public health. And that we need to be much braver, much more outspoken about those who abuse their power, about those who are overprivileged, and about those who have too much money. And for me, this includes challenging the way in which the health community embraces the Gates Foundation as being part of the solution, as opposed to being part of the problem, and speaking truth to power. So I hope that complements what Sridhar and Guppi have said in their introductory comments, and I'm going to stop there and hopefully create more time for contributions and questions from the audience. Thank you very much.
Thanks a lot, Dave. There's so much out there. I mean, I will not try and attempt at pulling all this together, but I think 2 or 3 key things that are emerging clearly is both the link to grassroots and local struggles and how that has expanded these understandings of the wider social and political and economic, as well as commercial determinants of health, which I know Sridhar also alluded to in the context of the corporate behaviors and accountability, and so did Dave and Guppi. I think that's really key, but I think the other point that you make is the object of that activism and what we and politics of participation that we talk about, how the gays also need to move away from suffering, vulnerability, and oppression to the oppressor to the other spectrum of that inequality. And I think I want to come back to the question of how do we realize that? I mean, how do we shift the gaze? But also, why is it so important now? What do you see as the single largest threat to a political project that is envisioning health justice and advancing health justice, advancing the right to health for all? And there are a number of different frames through which health justice has been conceived. Nancy Fraser talks a lot about from redistribution to recognition, as well as representation as a third dimension, touching upon economic, cultural, and political aspects of justice. What is critical? What is that one area that you feel this work should focus on? Can I invite Sridhar? Did you want to come in here?
That's yeah, it's just like the number one, like what do I think the number one? So I think that God, if I had to pick the number one thing, I think that there is, for me, one of the most difficult thing is the watering down of the politics by the people that Dave was referring to in his sort of talk, that the people with power and resources can significantly water down and co-opt the politics of equity and justice. And they do that very easily. So if you think about Black Lives Matter or decolonization and all this stuff, and think about how rapidly it's been taken up and being watered down, I think is probably my single most thing that I think about every day in everything that I see around me is this the real struggle, or is this the watered down version of it in order to keep going the way that we're going? And I think that I would say that that's the really thing. So my constant daily thing is, what is the process or the goal that I am committing to achieving and with other people in order to not get waylaid by the kind of co-option, watered down, holding on to the status quo. And so as a very clear example, a year ago, all the big countries signed up to a global collective action in solidarity, blah, blah, blah. And then a year later, they are sitting on essentially all the vaccines and for years to come, and they will decide how they're going to dole out the vaccines. So for a whole year, we were able to keep quiet because they said, oh, it's all fine. We've got it under control. And I think you'll see that. I see that in lots of other health agenda items as well. So I'll stop talking. Thanks.
Thanks, Sridhar. Guppi?
Yeah, if anyone's seen my Twitter bio, the description that I use for the Twitter bio is that I'm working towards building an economic democracy. And I think one of the thinking about health justice, it's the analysis is that we live in a society that has intentionally democratized everything around us through individualization, but also like the way in which multinational corporations and people in power determine what happens, even though we have this sort of visage of a democracy. And so in order to create economic democracy, we need to shift the way in which people have access to the resources they need to live and self-determine. So I guess the mission I have within Decolonizing Economics, and also some of the other projects I'm part of, including one with Centric Lab, with resource justice and with Health for a Green New Deal, is really like re-democratizing assets and access to land and self-determination around our health in order to bring about health justice. And there are multiple ways in which that can happen. And I suddenly realized that I sound a bit like Ash Sarkar on Piers Morgan, where she was like, I'm not a socialist, I'm a communist. And I suddenly realized that I'm probably a little bit of a communist. And in terms of like maybe the limitations to not the biggest challenge to that strategy at the moment. I was going to say like capitalists who are like really holding on to late stage capitalism and like really just believing that it's going to continue to exist. But actually, I think it's organizers who are working towards equity and justice, but have absolutely no idea what that means. And so like have a very sort of shallow or superficial understanding of that practice. And partly because they haven't got the analysis or they haven't had access to the analysis. And so they're kind of operating within the existing systems of power on, you know, and Dave mentioned the kind of charitable industrial complex is a really perfect example. The fact that we even have philanthropy as a system within society, like where the hell did that come from and why does it exist? And not connecting that with wealth accumulation and the sort of maintenance of systems of power within society that prevent people from self-determining the way they want to live their lives, but also like how they improve their health outcomes. And I think that Dave also mentioned, you know, people with power are some of the biggest people, like where we have big problems. But also I think people like us, so people like me, middle class person who believes that the middle class experience is the experience that I need to move from. And actually it's, you know, those of us who do have power, even if we believe ourselves to be good people, need to continuously work on the perspective we're coming from when we think about lived experience and what that experience is and what changes need to happen by continually interrogating, our kind of like our mindset and our practice. And we can only do that if we do it, again, like in relationship and through collectively organizing.
Thank you, Guppi. Really interesting point about, and I also refer to this as, and feminists have referred to this as personalizing the politics. And it's easy to identify the enemy and not reflect on our own politics and actions or even personalize ideas of equality and justice in our own lives. And we can only exacerbate what the status of the unequal world we inhabit today. Over to Dave on this point.
Very briefly, just in response to your question, I would say that redistribution is clearly, required for health justice, and not just in terms of economic resources, but we've got to be thinking about redistribution in terms of power, economic power, political power, but also the power to shape and frame narratives. And there are two things that can be done, provided there's enough political will. This is around corporate regulation, and there are ways in which we can limit corporate power. And the way in which corporations have become so powerful is such a fundamental threat to democracy, but also to the environment and all of these other kind of drivers of ill health. And the other is around the way in which society has become increasingly financialized. So we again need to be behind corporations to look at private capital and the way that finance works in society. And with both of those things, we have ready-made solutions, provided there's enough political willpower to implement them, whether it be tax policy or regulation of finance and banks, antitrust legislation. So the instruments, the tools, the technocratic solutions are readily available. But what we need to do, I think, to make that politically feasible is to really dismantle the narratives that allow corporations and finance to frame themselves as the solutions to the problems. And this is the brilliance of the way in which marketing works, that we seek. In fact, I'm doing some work right now looking at the political economy of breast milk substitutes, political economy of infant feeding. And it's so brilliant how these corporations are able to portray themselves as being the solutions to the problems of infant malnutrition, when in fact they're undermining breastfeeding as being both a cheaper, better, and more environmentally sustainable form of feeding. And this is partly about their ability to shape the narratives around infant feeding. So that requires a lot of education, I think, as well.
Thanks, David. I think one of the recurrent themes that I'm hearing is that whole ideological capture of the political imaginary. The dismantling of the narrative is what is quite critical, and as a first step for any such political project. How do we understand what the real health problem is? And how do we deconstruct that framing that corporations, states, and that nexus is putting forward? I'm seeing some questions in the chat box, and I'm going to just pose those, and feel it's not directed at one particular speaker, so please feel free to come in there. I think one of the questions is, okay, so in law, we have the minimum core obligations for the right to health to attempt to realize the right to health, but this has been co-opted by states to fail to progressively realize it. What, if anything, can we do to prevent states from arguing there's not enough money to prioritize this? Anyone wants to go?
I mean, my answer would be just not rely on the state. Like, it's interesting that through sort of socialist ideologies, there is a kind of reliance on the state as an actor, and a state does have definitely has a role in, you know, redistribution and reparation, but it has a history of violence. It has a presence of violence. Just look at what Priti Patel is doing at the moment, and the recent court hearing on Napier Barracks. You know, I think that I feel like rights are being violated continuously, particularly with this government, and that has been the case also internationally for such a long time, that our strategies need to recognize that the legal system and a human rights-based system has its strengths, but it's not the sole, it can't be the sole focus of a vision towards health justice, because in the end, again, we need to self-determine and need to not rely wholly on one institution in order to access what we need to live a healthy life.
I may slightly disagree with Guppi here.
Yeah, okay, go for it.
In that I think it's absolutely vital that we reclaim the state from the way in which it's been captured by various vested interests, to democratize the state. And you know, one of the things that I frequently hope with some of the students that I teach is that they will go into politics. Some of them will end up in politics because we need good people in politics. And I all too frequently hear people say, I won't go into politics because it's such a dirty business. And well, we've got to clean it up, really. But I think the state is vital in my respect to changing things. And that's not to say that popular mobilization and community empowerment and work from the bottom up isn't also important. But I really struggle to see how we're going to make much headway if we don't somehow recapture the levers of the state and find ways of applying those levers to justice and fairness.
Yeah, absolutely. I think also the idea of this monolithic state also needs to be challenged. I mean, there are states and there are multiple states and there are authoritarian states. And I think it's no more the argument about efficiency versus equity and rights or money, whether we have enough money. There are also states that are blatantly repressing and silencing voices. Again, that has come out very openly in the context of the pandemic. And there are clear human rights violations. And there are also these extremely dystopic nexus of the markets of other authoritarian regimes. And I think just the idea of a monolithic state is fairly archaic, within which the traditional understanding of social justice are circumscribed. So I think the need to also challenge that is critical. There's another question about how we can use the idea of health justice to promote and envision human and planetary flourishing, not just about what is so unfair in the world. So a more enabling idea of health justice than focusing on what's not working. Who wants to go? Sridhar, can I invite you?
So you know, the work that I do in philosophy is basically trying to make an argument that health is about essentially everybody being able to have a minimally decent life in a variety of different kinds of domains. That life is just not about being alive and avoiding disease and making money, that it's actually multiple kind of dimensions. And then we should sort of, you know, think about health as sort of having all of those different kinds of dimensions. And also, I think that there is much to say about individuals living sort of decently flourishing lives in an environment that's sustainable and in a way that they do it and in the way that they treat other living beings with dignity and not sort of as sort of I don't want to sort of use bad words here, but the idea is that there's a way of being able to live decently flourishing lives within a sustainable world with dignity to other animals. And I think that's quite possible. And I think that's one of the reasons that I do philosophy, is to be able to think about what could be and what should be, not just describing what is happening and what is wrong with what's happening. I think they're very informed, and arguments about what should be should reflect what's wrong. At the same time, I think that just as a philosopher, I need to make the point that it's very hard for get everybody to agree on what the ideal situation is, but it's sort of easier to be able to get an agreement on what the worst possible situation is now. And so it's greater for us to be able to have an agreement on sort of the most grossest injustice, health injustice, as opposed to getting an agreement on the ideal situation. So I think that there is both to be done. It's not an either or about let's not focus on, you know, this or that. I think this is why we have conversations like this, so that people with different strengths are able to come together to talk about different dimensions of it. Thanks.
Thank you. David, were you coming in there? Did you?
No, I'm just looking at the comments in the chat box about the state, and you know, they're all really good comments that I agree with in some respects. I guess for me, talking about reclaiming the state is partly about reclaiming power from the state. It's not about being part of a state that abuses its power, but it's about it's really about democracy to some extent. And you know, when we talk about justice, I think the concept of democracy is really important. And I kind of see democracy as a system that allows for a, you know, relatively fair distribution of power. It doesn't necessarily just mean, you know, you vote every 5 years, but it's really about the systems and institutions that allow power to be distributed, that creates checks and balances in society to prevent an over-concentration of power. And you know, and it's absolutely because the state is problematic in so many countries and all across the world that we need to reclaim the state so that it serves people in a much more democratic, accountable, fair, just and just way. But I guess we can conceive of the states in lots of different ways. The state, you know, does need to be reconceived and reconceptualized and reimagined. So that probably is a challenge about how we conceive of society and what we mean by the state and society.
Sridhar.
I want to just add to that I think that we should not polarize this conversation as being, is it the state or is it the non-state actor that can do this work? I really want all of us to be open to the idea that in different places, different institutions have a role to play in this particular story. We also need to recognize a large number of new kinds of entities that have opened up in this or that are emerging in here, whether it be locally or transnationally. The fact that, for example, human rights law only deals with the state is one of the most fundamental problems that it has. So all these other actors are working away without any kind of frameworks or accountability. So I really think for us as people who are interested in health justice, we need to be more open to say, so there is the state, there are NGOs, there's also transnational, professional organizations, there are different kinds of entities, and some of you might actually be working on identifying these actors that sort of are there, that we are not acknowledging and recognizing as being significantly influential. So I think that let's not make this into is this a state solution or a social community sort of solution. I think that we need to be much more open and acknowledge lots of different kinds of actors that have potential here. Thanks.
Thank you. Yes,
I want to quickly just, I basically agree with Sridhar, and I think that maybe the question is not necessarily about what we agree as the end goal, but like where these interventions or this area of focus sits within the strategy of systems change and like what we see as the process of systems change. And I think that definitely, like, we can't dismantle the state right now, but imagining how we transform the state in this process towards health justice, wherever that might be, the distance or the end goal of where we have might be slightly different, but it's kind of the same journey. And slowly we will learn, as Sridhar said, like more creative ideas around different institutions, different networks, and different ways in which communities can organize and engage with each other around the assets they need in order to live healthy lives will emerge once we've kind of got rid of some of the shit stuff. And I also think that there was just it's interesting that question around how we can use ideas of health justice to promote and envision human and planetary flourishing. And just underneath is exactly the point that I wanted to make, is that there is lots of visionary work around disability justice, around care work, around indigenous practices that has been around for a really long time, but really uncovered. And I think maybe the last year, specifically in the UK, there has been an opening of a conversation around the care economy, around the living economy, around regenerative economies and how they are being practiced, because people are, we have mutual aid, we have solidarity economics. All of these practices are practices that have been around for such a long time within marginalized communities, not just in the UK, but internationally, because people cannot rely on the state, or they can't rely on other institutions or structures that are there to provide. And so there is just a reliance on each other. So I think that like using some of that history and using some of that knowledge and practice, particularly within, I think about the pandemic in the last year and just how little people talked about the HIV crisis and how, the queer community during the HIV crisis, had creating systems to be there for each other, had created systems of care, had created systems where they work to access medicine in the same way that many communities internationally are now doing around the pandemic, around working to support each other, to protect each other. And there's just so much hidden history that isn't shared within this kind of otherwise quite academic or policy focused space that really needs to be uncovered to recognize that those economies exist, and they just need to be supported and invested in and promoted. And I think that will maybe give more of a positive slant to what the alternative visionary world that we want to create could be, because I think it does exist. It's just hidden under lots of, policy, academic, and slightly focused in mainstream thinking ideologies.
We talk of institutional memories being short-lived, and I think that the same can be said about the collective memory of the global health community, because we have really failed to learn and transfer lessons from previous pandemics into this, the current crisis. I'm conscious of the time, and I think probably we can spend the whole evening speaking about these issues, But I want to come to the last segment and before I hand over to Rhiannon, who's going to talk about future steps and also the poll. And just sort of to close this discussion, I really want to hear from you your vision for a future that can center health justice and some ideas and suggestions around what is one value or an action that you would want the People's Health Watch should espouse in its journey to realize its vision. Whoever wants to go first.
So I'll go first, just so that give time to other people to think. So my sort of big issue, I think the thing that I'm concerned about is the idea of putting health into more central to our ideas about justice and social equity. It's been considered so marginal. It's the economy that's always talked about. It's income inequalities and poverty that's always talked about, but we haven't put health in the center of it. And I'm hoping that we continue to do it. And I'm willing to bet that it will be sidelined as other people with, expertise not in health simply go back into, sort of taking sort of their sort of position and sort of claiming the same policy space. But I think we have to sort of put health inequity, health justice at the center of our public deliberations as much as we talk about the economy and economic growth on a weekly and a quarterly basis. I think that would be sort of the really important achievement. The value that I think has to be is this idea of justice. Like, don't take away the word justice from the central focus here. It's not equity, it's not inequalities. I think the word justice has much more capaciousness in its ability to think about the multiple dimensions of health that we need to be thinking about rather than just outcomes or healthcare or something like that. Thank you.
Thank you. Guppi, do you want to go next?
Yeah, I just want to riff a little bit of what Sridhar said around like not forgetting the focus on justice. And recently read excerpts with a group from a book called The Black Imagination. And the book is really like even asking the question about how can you envisage a world in which you as a Black person can live free of oppression or free of trauma. And just even asking that question was so difficult for someone to believe that such a world could exist was so significant to understand that, we dream like all the time, but some people don't even have the capacity to dream. And so it's, part of our work towards health justice is creating conditions in which we can offer people the conditions in which they can dream of a world in which they're not experiencing oppression, or they're not experiencing trauma, they're not experiencing violence, and they're not subject to bad health outcomes that are a result of some other power and entity that exists and nothing to do with their kind of like personal decisions or private decisions. And so I guess that's like my vision. It's like, people get the choice to decide like how they want to live their life and how they engage in society and have access to all the tools and resources they need. And I just think that, the first step is often just even giving that space for that imagination to exist. Like there's a line in the report from last year, which is from Adrian Murray Brown, which is, imagination is a spoil of colonialism, and to imagine is a practice of liberation for Black people and for really any marginalized group of people. And so just creating that space is just so important. And I think really conscious of that as an author, and someone on this panel, and in like every time to try and quote and reference groups who have managed to practice that. And I think that would, do wonders for the way we organize and what we organize towards.
Thanks, Guppi. Dave.
Thanks. I guess I still want to go back to this theme of power and the need to find ways of redistributing power across society. And that's partly what I'm referring to when I talk about the state. because I see the NHS as being part of the state. I see the justice system as being part of the state, Parliament as being part of the state, public universities. If you think of all the great public health interventions around water and sanitation, you know, there are these elements of the state which, you know, which are potential forces for progressive change, for good. And it's about how we reconfigure, reimagine that state. And someone put in the chat box the notion of assemblages of power, and that might be a different way of getting at the same concept. And I think this is especially important because of you know, the real possibility that unless we do this, unless we kind of recapture the state, the way in which technology is developing really creates all kinds of potentials for a truly dystopian future, where technology can be used in a way that will not just undermine justice, but undermine freedom, liberty, and many other things we currently take for granted. So there is a real threat, I think, that if we don't think about how we gain control over the levers of power, that we will become ever more disempowered. And we've got to be thinking really tactically and thinking about institutions of that can prevent that kind of dystopian future from happening. So that's a bit of a pessimistic and gloomy note to end off, but you know.
No, I think thinking about the assemblages of power and thinking about redistribution of power is probably a useful entry point to even reach the enabling conditions that Guppi you were referring to, because I think the challenge is how do you build those enabling conditions if you continue to act in silos. I mean, unfortunately, where we are failing today is not making those bridges and identifying synergies and acting in solidarity with these, those who are trying to bring these or create these enabling conditions. And I think that thinking about that redistribution of power allows us to look at those intersections, look at of these conditions, and work together in solidarity and collectively. But thank you so much. I mean, there's a lot to unpack and discuss, but I'm conscious of time. But they're really very exciting ideas and inspiring thoughts. And with that, I want to hand over to Rhiannon, who's going to talk about what next. How do we move from discussions of health justice to action around health justice? Thank you.
Brilliant. Thanks, Anuj, and thanks so much to the incredible speakers. Hopefully everyone is feeling super motivated to take action and build coalitions for health justice. So with that in mind, I'm going to talk kind of super briefly about how people present can get involved going forward and be part of this journey towards collective liberation and health justice, we hope. But first, kind of in the spirit of co-creation, we are still in the process of determining what we're going to do exactly going forward. So we'd love to hear from you about what issues you think are most urgent and most pressing that the People's Health Watch should examine and look at as part of our work. So yeah, we'd love to know kind of what topic of health justice you think that the People's Health Watch should prioritize looking into. So, and kind of this can be anything, as we've kind of discussed today, how broad the topic of health justice is. So if you want us to talk about food justice, mutual aid, democracy, racism, basically we'd love to hear what you think should be our kind of immediate priority to examine. So please do go to the Menti, and I'm going to give everyone just a couple of minutes to fill that in, and then we'll have a look at it together. And then I will talk about 3 different and really exciting ways which you or your organisation can get involved in organising. So yeah, if everyone wants to go to that Mentimeter, that would be really great. And I will put on a bit of music for a minute or two while people think about that.
To my own devices. When your Coca-Cola eyes are out of my face, I checked your phone and no surprises. She's grinning from ear to ear in purple lace. So take your orchids elsewhere, elsewhere.
Cav, do you want to show us kind of the word cloud and see what we've got so far? And please do keep adding. Oh my goodness, so many. Thank you so much. Oh, this is brilliant. Thank you so much. We will definitely put this into our planning. And speaking of which, if you go back to the slides, Cav. I'm going to talk about 3 ways in which you can get involved in the People's Health Watch. Like, as we've mentioned, we want this to be very co-created, grassroots, and there are loads of different ways to get involved depending on kind of what your capacity is and what your interest is. So the number 1 way to get involved on this list is to contribute to our evidence gathering process. And what we mean by that is we are basically collecting evidence, testimony and analysis about health justice and injustices, kind of specifically in the UK, but kind of global lenses are also brilliant. And this can come under any topic, so kind of food, gender, housing, education, social care, and we welcome evidence on any issue. So this includes kind of any personal testimonies, any research or analysis you've done, and contribution can take any form. So it could be a piece of writing, it could be photography, it could be a video, it could be poetry, and it will contribute to kind of the watch on the website. And you're also welcome to submit a kind of work that is already published that we can kind of amplify, as well as things that are new. As Kavian mentioned, we're going to be kind of hosting gatherings, and these might be hearings, they might be kind of fun creative events looking at different topics of health justice. So these will hopefully be very, very reflective and participatory and cover lots of the main social and political determinants of health justice. So if you or your organisation has a particular area of interest or expertise and would like to collaborate or co-host a session on any of these topics, like any of the topics that were just mentioned in the word cloud as well, then please do let us know. And finally, one of the ways to get involved is joining our team. As you may have picked up, the People's Health Watch is run by a small group of us, and we're always looking for new people to get involved. No matter kind of what your skills or availability are, you'll be given some training and onboarding, and you don't need any prior experience, just a passion for health justice. So all of these different ways to get involved are all done by kind of the same Google form, which I will put in the chat now. And there's also a get involved page on our website in case you want any of that information again. And if you don't kind of want to write anything or join the team or host a workshop, that's also fine. And we'd love you to kind of keep up to date with our work. So if you go to the next slide, just to kind of like stay in touch with what you are doing, please do sign up to the PHM mailing list and follow us on social media, and the links to do that should be going in the chat about now. But yeah, we would absolutely love any of you here who have an interest in health justice to be involved in the organising of the watch or contributing evidence in kind of any way, shape or form that you would like that to be in. So I think that's it from me. And I think that's it from the rest of the team as well, other than just to say thank you so much to everyone for coming. Thank you so much to the speakers. Thank you so much to Anuj for facilitating. It's been, yeah, a real pleasure to have you all here and be talking about such an important topic. So have a lovely evening, everyone, and hopefully see you very soon in different capacities.
Bye, everyone. Thank you very much. Good luck.
Bye. Thank you, everyone, for the incredible event you put together.
Oh, thank you. I was like, I wanted to say hi and like, well done, but then I was muted. But that was great.